It's about 7 o'clock now. I'm getting into the hospital. All right, so I just finished rounding at our first hospital, which is Ohio Health Grove City. We had 3 patients there that I saw. 2 of them able to be discharged today. One of them will remain in the hospital today, still has a drain after a lumbar fusion surgery, and that drain is still putting out a decent amount. So we'll keep that patient in the hospital, and then maybe they'll be able to go home tomorrow. So we'll come back tomorrow, check in on them, and then see how it goes from there. All right, we finished in Grove City. Now we are heading to Ohio Health Pickerington Hospital. This is another hospital where we are able to perform complex spine surgery. So one of my partners has a couple of patients who were operated on yesterday who are there in the hospital there. So I'll go see them, see how they're doing, check in on their progress, help them advance their care, and then we'll be off to our 3rd center. So that's kind of what the morning will look like. You know, I'll be stopping at, this morning I have a total of 4 hospitals to cover. You know, we're a group of 8 brain and spine surgeons. And so, you know, depending on which of my partners have patients who are still in the hospital and which hospitals, you know, whoever covers on the weekend has to visit those hospitals to see those patients, and we help each other with coverage to make sure that all of our patients are all doing well. All right, so finished rounding at our 2nd hospital. Saw 2 patients there. 1 patient doing very well. Going to be discharged. The other patient had some new leg pain. Anytime after a spine surgery, you know, we're moving nerves around. We're putting in, for fusion cases, we're putting in rods and screws. We're putting in cages. So you don't want to make sure if a patient has new leg pain, new leg symptoms, that all of that hardware looks good and there's nothing that's pinching or pressing on a nerve. So for this patient, I've ordered a CT scan. So that will be done this morning. In the meantime, I'm started her on a couple doses of Decadron, which is a steroid medication. And that will really calm down and help any of the inflammation that you might have on the nerve while we're still figuring out what's going on. Sometimes nerve pain can act up after surgery just because we're having to move the nerves around in order to put in some of that hardware. So hopefully just, you know, just a little bit of inflammation or radiculitis on that nerve, and her symptoms should get better. But I want to get a CT scan just to make sure that we're not missing something that might need to be revised. So always like to be thorough and investigate. Anytime a patient has complaints, it's very important to listen to those complaints, really try to figure out what it could be, make sure we're not missing something. And then obviously we can move forward with things like therapy and symptom control. But the first step is making sure it's not something else that's causing an organic pain on these nerves. So we'll get that one, you know, hopefully in the next couple hours. That CT scan will be able to get done, and then I'll review that and we'll kind of make our next decisions from there. In the meantime, now I'm heading to our 3rd hospital, which is now part of the Mount Carmel system. So in private practice, we're part of a variety of different hospital systems. We have patients in Ohio Health, we have patients in Mount Carmel, and we really try to focus and take care of those patients in whichever system they're already a part of. So for example, If that patient has a primary care physician who is in Mount Carmel system, then we would elect to do their surgery in a Mount Carmel system, and that helps to really consolidate their care, keep everything in the same system, really simplify things rather than having that patient jump back and forth between systems, have medical records that are very different areas and much harder to really consolidate and coordinate care when they're scattered like that. So now I'm going to Mount Carmel Hospital, see some of those patients. I have a couple of my own personal patients in Mount Carmel, currently in New Albany, as well as some of my partner's patients there as well. So we'll round there, see how those folks are doing, and then keep things moving along. In the meantime, for my drive, I was able to procure a protein shake from the physician's lounge. So I'm gonna have that one while I drive to keep me going, give me a little sustenance, and keep me on the road. So that building actually is our ortho-neuro headquarters, which is here in New Albany. It's actually attached, and I'll show you here, flip the camera around. So here is our clinic building, ortho-neuro headquarters, and our building is actually attached to the hospital of Mount Carmel, New Albany. It's just sort of building next door, and it's annexed on there. There's a little tunnel that we can take in the wintertime, but connects the hospital, which is right next to it, which makes it very convenient because, you know, I have clinic 1 to 2 days a week, and most of the time I'm here in New Albany. And then if I have patients also in the hospital, it's very easy to come by the hospital, can stay within the building indoors, and then come for rounds. So now this is our parking for the doctors here in New Albany, and then that's the hospital building actually right there. So I'm gonna park and then head in to see our patients here. All right, so I just finished rounding over here in New Albany. Picked up a Sun Chips from the surgeon lounge here. And now I'm gonna be heading over to my fourth stop, which is another Mount Carmel hospital. It's called Mount Carmel St. Anne's. So this hospital, St. Anne's Hospital, is what we call a full service hospital. So basically any patient who may have some slightly increased medical comorbidities, you know, renal disease or cardiac history with cardiac stents, those patients need to have surgery typically in a larger facility because we need to have cardiologists available on standby. We need to have kind of a bigger team present and available if there were to be any kind of complications. Now, most of these patients do very, very well, but it's always good with patients who have some history of other medical conditions to have those other teams available in that hospital if you are to need them. So I'm heading over there to the fourth hospital. I've got a couple patients over there as well. And then after that should be in the clear. I'm going to review that CT scan. Hopefully it'll be done by the time I make it to the next hospital. Review the CT scan for the patient previously, and then hopefully that should be it for the day. All right, so here is St. Anne's Hospital, full service hospital. This is the side entrance that I take right next to the physician parking. It allows easy access to the patient floors and also very quick access to the OR. So this is where I take. So let's go see our patients over here. All right, so finished at our fourth and last hospital, St. Anne's Hospital. There were about 4 or 5 patients over there from myself and a couple of the other surgeons in our group who I saw advancing their care. CT scan for our other patients still not yet done, so heading home now, and then I will log in, do my notes, progress notes, and then check to see if that CT scan is done, and then call in and chat with the patient and kind of give them the update. So probably about another hour or so of work to go for the day, and then I am on call for the rest of the day and the rest of the weekend actually. So right now it's almost 1 o'clock. Almost 1 o'clock. Gonna go have protein shake, pre-workout, do a little workout, finish up some of this work from the day, and then I'm available if anything else comes up for our group. So that'll be pretty much it for this vlog. Hope you guys got to see a little bit about what a day in the life of an on-call neurosurgeon is, and I will catch in with you guys later. Cheers.